Hello, welcome to another session on YouTube Live, LinkedIn Live at Data Safeguard. We have Elliot, our Chief Privacy Officer. We have Bill, our Director of Corporate Sales. Welcome, Elliot and Bill.
Thank you.
Thank you. Great to be here.
Great, thank you for joining. And today we will be talking about safeguarding and protecting healthcare information. Those who are new to Data Safeguard. So we are an AI-empowered SaaS company in data privacy solutions. We are solving data privacy and synthetic fraud global challenges, eliminating regulatory fines, preventing fraud losses, protecting data breaches, and building your consumer confidence. So let me set the context. In today's data-driven healthcare landscape, the intersection of ethical consideration and innovation is paramount, especially when it comes to safeguarding sensitive patient information. Healthcare data privacy is not just a regulatory obligation, it's a moral imperative. However, it is equally crucial to harness the power of data for transformative healthcare solutions. Striking the balance between these two imperatives has never been more critical, and this is where the ethical and innovative use cases in healthcare data privacy come into play. Data Safeguards ID Redact is a data redaction solution that permanently removes protected health information, PHI, from datasets. It does not mask data, but rather deletes it entirely, making it impossible to re-identify individuals. This is a contrast of other data redaction solutions that only mask data, which can potentially be re-identified using the sophisticated techniques. Our, our ID Redact is a valuable tool for safeguarding and protecting healthcare PHI. Healthcare organizations are under increasing pressure to protect patient data from different breaches and other security incidents. The Health Insurance Portability and Accountability Act, known as HIPAA, requires covered entities to implement reasonable safeguards to protect PHI, and failure to do so can result in significant penalties. If you see 2023, an average cost of data breaches was 4.3 million US dollar, according to IBM cost of data breach report. The healthcare industry was the most affected industry with an average cost of 9.4 million per breach. A major data breach can have a devastating impact on healthcare organization. In addition to the financial cost, breaches can damage an organization reputation and erode patient trust. So we have our expert here, Elliot and Bill. We will talk about how the ID Redact will be helpful to healthcare organization to reduce their risk of data breaches and protect patient privacy. It is a proven solution that it has been used by healthcare organizations of all sizes to permanently remove PHI from data sets. So welcome back again. So my first question to Elliot, what are some specific examples of how ID Redact has been used to protect PHI?
Oh, thanks, Daniel. Thanks for that introduction. You really covered a lot of what I was going to say. So I guess I have to start improvising. Well, protecting patient privacy and confidentiality has to be a number one priority of the, say, supply chain in healthcare of information. We need to ensure that patients' personal and medical information is only accessed by those who are authorized to use it. This is just absolutely important for patient trust. The breakdown of trust not only affects the patient financially, economically, but can have a dramatic effect on their ability to heal. So it transcends just the safekeeping of data. It can materially affect the patient. And as Damo mentioned, in the US, we're governed by HIPAA, which is the Health Insurance Portability and Accountability Act, but every country has the equivalent laws and regulations that require healthcare organizations to safeguard healthcare information. You know, in recent years, there's been an enormous amount of data breaches and cyber attacks into healthcare. And healthcare organizations have built up their perimeter defenses, their network security, firewalls, password protection on terminals. Um, but we're finding there's still access sometimes
Yeah.
un, you know, unknown to the security people of personal healthcare information. So we really want to get to the bottom. But Damo, you asked for some specific examples.
Yeah.
And Bill,
Yeah.
I was thinking that, we've talked about healthcare in schools. We've talked about healthcare in healthcare administration. Do you have some specific examples that maybe we can turn to?
Well, certainly. I mean, the data itself, you commented on providing good quality care to a patient. In order to do that, schools, institutions, healthcare organizations in general have to do a lot of research and training. And that data can be used, or a semblance of that data can be used, or the context of that data can be used in those efforts to train and do the research.
Yeah.
Just for review, maybe going back to the HIPAA comment, there is like data can be used for the treatment of the patient, for the payment, for services rendered, and for the operations. And that data has to be necessary, and it has to be in a production environment in order to provide that. Outside of that production environment, though, it should be redacted because of the concern that it can be leaked. And as you commented on, breached and used in various ways.
Yeah.
And that is, essentially the source material that hackers use to go out and create synthetic data, or to do other things, criminal events out there with that data.
Yeah, I was thinking that one use case that might make sense is the hospital has an analytic department to look at demographics and care of patients and quality of care and various things. And so someone might log into that and extract information for spreadsheets and Excel or a PDF or a Word document.
Mm-hmm.
They might leave for lunch and leave their terminal active. And somebody might be able to use their terminal to access very important information. But they also have downloaded information. We want to make sure that that downloaded information for use, which is important use, is anonymized by using redaction. We don't want there to have personal health information that can be identified against a person as part of a spreadsheet or a PDF that's used for analytic. So you're not necessarily impacting production system, you're impacting downstream applications that might be used.
Yeah, in general, it's going to be used before, when you're leaving production, you're going to do data distribution, as we talked about, for research or marketing purposes, or maybe just after project completion, or even archiving and disposal. When you're actively moving data out of production, you should be looking at redaction.
Super. I agree completely. Another example that comes to mind is the Veterans Health Administration, VHA. One of the largest provider of healthcare to veterans, ex-retired military. They need to be able to redact personal information that's shared with people doing research. Some of the most comprehensive research is being done using the tremendously large database that VHA has. At the same time, you have to ensure that their patient information and data is protected, even though it might be shared outside of VHA.
Super.
That's again, healthcare probably provides such a horizontal source of information, not just demographic, but illness for research study, age, cost of living, all have major impact. And yet, using that information does not have to include a patient's personal information so they can be identified. You can anonymize that information and still use it as valid, but not impact a particular patient.
I think great inputs. If I come back to our data safeguards ID redact, so let's talk about this product a little bit in details. So what are the costs of using our ID redact?
In general, that's based on the size of the data set
Mhm.
and the use of ID redact in the context in the context of that data set. So it's rather dependent on what is trying to be attempted to manage.
Yeah. Bill, you really you're spot on. In my personal analysis, I like to think of data safeguards products, not just ID redact, but ID mask, ID fraud, as the equivalent as if they're insurance policies.
Mhm.
By using them, you are spending money, like you spend money premiums for insurance, you are spending money,
Yeah.
but you're protecting yourself against massive fines and massive loss of reputation. So, from that point of view, it's a very cost effective solution.
Yeah.
And could be looked as an investment rather than an expense.
Well said. Yeah.
Absolutely. Yeah. So, I think bottom line, as a privacy person who deals with this every day, it is an investment in the company in that by installing it, by using it, there's ancillary benefits. It has sort of a ripple effect through the organization. You have to train people. You have to let people know what you're doing. You have to explain what the output of using one of the data safeguard products is. And so that whole preparation helps an organization, um, again, look at information in a completely different light.
Absolutely. Are there any limitations to using ID redact?
Well, let me take a stab at that.
Sure.
What we're seeing is more and more data types being brought in as our data sources become more and more sophisticated. It wasn't long ago that people manually entered a passport number when traveling overseas, or it was scanned and just the passport number was entered to see if it was valid. Well, now you're using passports to recognize a person by the image, their first name and last name, their address, their date of birth. So there's a ton of information in a passport, and that's evolving. Passports also have protection against fraud with stamps and special materials and background. Well, that's something that's going to be evolving in safeguarding information. Other areas are, as more and more data becomes digital, you're seeing more and more image based data appearing as part of records. And in many cases, scrutinizing that image. And let's make the assumption that that image is not scanned, it's something that's purely an image.
Okay.
You need to have intelligence to scan that image, have intelligence to spot personal health information, and so forth.
Well, you could even extend it to what we're doing here right now. I mean, this is where medical interactions are happening between doctors and patients in a virtual visit. And how are we going to secure this data as it becomes part of the record?
Yeah, very good. I've noticed that many of these new primary healthcare facilities are offering virtual visits as a
Mhm.
absolute source of communication. And there again, as you said, Bill, you have the patient and the doctor um, talking and providing very intimate and PHI information. And in our case, we would expect that information to be encrypted. And if it is recorded, that it's safeguarded. Well, if it is recorded and that information is reviewed, it would be important to, again, use ID Redact on any information, whether it be captioned, uh, whatever is being recorded, so that that information can be used but not directly impact a patient's privacy.
Great. If you want to learn about ID Redact, feel free to visit our website, datasafeguard.ai, and you can see it's already there, and we have also launched in our Azure Marketplace. So please visit. Any additional information, Elliot, Bill, on ID Redact and safeguarding and protecting healthcare data?
You look at right now, almost every state in the United States has followed California's lead and invoked privacy standards for their individual state. If you think about Delaware, a huge number of companies are incorporated in Delaware for tax reasons. Well, Delaware is putting together a very stringent equivalent of California privacy practices. And that means every corporation that uses Delaware for tax advantage is going to be under that umbrella and have to provide those kinds of privacy assurances, not just to Delaware, but to their organizations. So I see a huge increase in the number of medium, small, and large companies taking data privacy and wanting to redact information as a emerging business competitive advantage.
Absolutely. The bottom line is essentially data redaction should happen after treatment, payment, and operations have concluded. And it should just be part of the system of a standard operating procedure. Let's just call it that.
Absolutely, absolutely, yeah. And I can see there is increase in data privacy breaches across organization, and especially more in healthcare, right? And yeah, I mean, and I talk about that IBM report, how organizations are actually fined, right? Billions of dollars, and absolutely. So, I mean, data safeguard ID Redact is a valuable tool, I can say, for safeguarding and protecting healthcare protected information. And it's a proven solution, that has been used by healthcare organizations of all sizes to permanently remove PHI from datasets. Yeah, Elliot, Bill, any concluding remark on ID Redact for healthcare organizations?
Yeah, as you mentioned, people should get in touch with you if they have any further information, perhaps see a demo, perhaps get more involved in some of our practice and some of our subject matter experts. But addition to that, I think if you're a smaller company and you're just starting your research into this area, think about the individual communications with patients, whether you use a online messaging medium, you take patient information and allow patients to put it into a calendar for scheduling purposes.
Yeah.
Think about all the information that's on that and whether it's necessary or not. And again, we're trustees of personal information, but the patient owns their privacy and owns their information.
Yeah, and to that point, I would just also like to underscore that our services, in this case, Data Safeguard, it scales very well from the smaller interaction to a large interaction, because it is necessary to protect data up and down that scale. everybody's individual record is very important to them, and it should be protected with the best security that's out there, and that's redaction at this point.
Absolutely. Thank you so much. If you are interested to learn more about ID Redact, please reach out to us, visit our website, visit our LinkedIn page, reach out to me, Bill, Elliot. We will be happy to show you how we are actually building the future of data privacy product, including ID Redact. That is the flagship product so far we have built. Thank you, Elliot, Bill, for your insightful conversations. And we will come back with another session with another topic very soon. Till then, take care. Bye.